I am a second-year medical student here to help you improve your clinic.
What qualifications do you have to do such an improvement?
I did an online training module and I am now ready to improve your clinic. What can I improve?
There are patients who know more about the clinic than you do. What can you do to help?
I need to help you fix your clinic. It is for a school project. I need to do this project to pass.
You have to help improve something you know nothing about? How medical school has changed. Well, we do have a problem with how pediatric DKA is managed in our emergency room.
DKA. Donkey Kong action? I love me some Donkey Kong action. I am so good at that game.
No, you misdirected student. Diabetic ketoacidosis. We need a better way to standardize these patients' care when they are seen in the hospital.
So with this Donkey Kong acidosis, there needs to be a chart or something on when to give the patients bananas or tom-tom drums? If I bring my own tom-tom drums, will I get honors? I hope to specialize in dermatological plastic surgery, so I need honors.
No, it's diabetic ketoacidosis. There is no Donkey Kong. And that specialty does not exist. We just need a chart of some sort to help the team all know the protocol to care for these patients. Can you do that? Also, how might we incentivize these groups to adhere to the changes?
Bananas.
Get off of the bananas.
Okay, I will come up with a presentation and show it to you tomorrow, okay?
Sounds like a good plan. You might just get honors yet.
Really?
No, ha 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 ha.
And now, in honor of our classmates who watch from home, here is our presentation.
One of our group members witnessed a toddler in the ER forced to wait 3 hours for the start of treatment for DKA due to provider inefficiency, less than clear expectations, miscommunication, and problems with the electronic health record. We decided to look at improving the management of pediatric ketoacidosis in the acute care setting. For many emergent conditions, protocols based on evidence-based medicine exist to ensure proper care for our patients. However, protocols are not universal, and in some hospitals, many less common, but still dangerous, conditions are left without clear guidelines for treatment. We identified a need to develop a protocol for the treatment of pediatric DKA that is consistent with current professional knowledge. DKA is a complex metabolic state of hyperglycemia, ketosis, and acidosis. The primary serious complication is cerebral edema, and DKA has a 2 to 5% mortality rate with current medical treatment. People, especially children, with undiagnosed or uncontrolled diabetes are at risk for DKA. DKA is the presenting complaint in approximately 25% of newly diagnosed patients with type 1 diabetes mellitus. DKA is often insidious, with patients eventually presenting to the emergency department, where our quality improvement measures would be put in place. Because children often present without the classic symptoms of DKA, our intervention would include educational components for the physicians and triage nurses. There would also be educational opportunities for parents and/or caregivers. On an organizational level, we would create an evidence-based pediatric DKA protocol in the electronic health record to include necessary diagnostic tests and medications. We would create posters to simplify and remind ED staff of the proper treatment protocol. Our intervention is mainly aimed at the ED staff providing care, but also the parents of children with diabetes. Fortunately, the electronic health record tracks key indicators and makes data collection much easier. We would have a quality improvement team analyze the treatment data to assess the structure, process, and outcomes of our quality improvement measures. In examining the quality of care, we want to address the level that our services benefit individual patients as well as the population. This would include looking at many details surrounding the diagnostic testing. With DKA, evaluating safety, efficacy, patient-centered care, efficiency, and equitable care is closely linked to the timeliness of proper treatment. We would therefore look at the timeliness of treatment using the electronic health record. Specific measures would include time to IV normal saline bolus, initiation of DKA labs, insulin drip, and hospital admission. We would also consider the neurologic status for progressive symptoms of DKA and eventually mortality rates as the health outcome measure. To provide incentive, compliance with the new quality improvement measures would be addressed in annual performance evaluations for physicians and other ED staff. Furthermore, the training portion of our project would meet continuing education requirements for a variety of healthcare professionals. As with any quality improvement project, there will be financial costs which will have to be addressed. Additional hurdles include physicians not feeling comfortable treating the condition, lack of documentation and compliance, complications for complex patients, and being able to find and adequately compensate a quality improvement team to work on the issue. As a group, we have thought of some proposed solutions to these hurdles.
Go ahead.
Thanks for watching. watching a movie about Raspberry Blueprint.
Good kid.